Good morning. I'm George Latimer, Westchester County Executive. It is Wednesday, April 29th. And as we continue to deal with the coronavirus outbreak here in Westchester County, this is our Facebook Live, 11 o'clock or as close to 11 as technology permits us to have our morning COVID conversation. We've had discussions in the past few days, past few weeks, actually, with a variety of people that are involved in one way, shape, or form with the change that we're going through in our life because of what's happening. We've talked about the economic impact. We've talked about the impact on our taxes and our ability to pay them, what's happening in a host of different fields of endeavor, mental health, as well as physical health. But today we're going to get a discussion. We're going to have a discussion with a person who's on the front lines of this. This is like talking to the folks who are in a forward unit in a military battle. There are people who are infected by COVID on the front lines. Our guest today is Catherine Manley-Cullen, and she is the Chief Nursing Officer of Northern Westchester Hospital, right here in Westchester. And Catherine, we appreciate you taking the time from your busy day to be with us.
Thank you. Happy to be here.
So I guess the most general question to open up with is, what are you seeing out there in the field? At the hospital that you're at, you serve a large quadrant of Westchester County and out of Northern Westchester, Mount Kisco. Are you still seeing a lot of patients being admitted with COVID-19? How are things going?
Well, I think like all of the other hospitals in Westchester County, we have certainly seen our share of COVID positive patients. The good news is that we're now in a recovery mode. So we are seeing fewer patients being admitted to the hospital that are COVID positive, more and more patients being discharged from the hospital. We have over 200 lives saved as of this week, patients being discharged. Our ICU, which had swelled, we had two separate areas we were running as an ICU. We've now been able to scale back to just our original ICU. So I think, it's looking good at this point. Things are starting to get better. There is light at the end of the tunnel, and we're incredibly hopeful. Every time we discharge a patient, we play a song overhead. Here Comes the Sun by the Beatles. The staff absolutely, it brings them such joy. The patients love it. And that song is now being played throughout our entire Northwell system. All of the hospitals are doing that every time a patient's being discharged. So a lot of hope and a lot of promise.
Well, that's certainly good news in the experiential level. We've looked at statistics that show that we have flattened the curve. Both the number of hospitalizations are decreasing and also the number of active cases. Even though the number of positives continue to go up, the number of people that clear the 2-week incubation period is growing faster than the number of new cases. So therefore, the number of active cases are going down. You obviously have a problem, even if you had just one case, in making sure that all of the patients are safe and that your staff is safe, the nursing staff, obviously the other professionals that are in the room, the therapists and the doctors themselves. How is that going? That clearly must be a very stressful situation to make sure that the medical professionals as well as the patients are as safe as they can be from this contagion.
Yes, and that's certainly our top priority and always has been throughout this whole pandemic. Right now, we have separate COVID positive and negative units, so it's safe for patients to come to the hospital. We have 26 private rooms in our emergency department, so we're able to separate patients that might have signs or symptoms of COVID from those that don't. We're very concerned, certainly, about our team members and making sure that they're safe. We have been fortunate enough to have a lot of PPE, personal protective equipment, that we've been able to source either through the larger Northwell system or through in Westchester County. Your own emergency operations center has been incredibly helpful. So we have whatever the staff needs in terms of keeping them safe. And I think that they're pretty appreciative of that. We're able to keep our patients safe by having separate areas where they're being cared for. We take meticulous care to make sure that staff know how to don and doff the PPE correctly. We have spotters that are watching them as they're donning and doffing PPE, and making sure that we have the right air pressure in rooms. We have the right HEPA filters, venting as we move back into our recovery mode. And we have more and more of our hospital units that are now COVID negative units, making sure that we're doing incredibly good deep cleaning so that those areas are safe. not only for patients coming in, but also for our staff that are working there.
And I'm sure that the nurses and the other medical professionals that are there really do feel like they're in a battle line scenario. It may be lessening now than it was perhaps earlier in the month of April. How are they feeling individually? What does this do to a person? You've obviously trained as a nurse to handle a variety of realities. This is an unusual reality. You're trained for it, but it's not something you see every day, and you don't necessarily see the volume of people ill in this fashion every day. What's it like for the individual who is, performing this kind of function up close and personal with the patients?
I think we all like to believe that we have trained for this our entire careers, and certainly feel like we had some great preparations in place. But I mean, let's face it, no one ever imagined that they were going to be living through a pandemic. Certainly, I think a lot of us didn't imagine that. So it's been difficult. I mean, staff, healthcare providers have been day in and day out working on units with patients that are so very sick. Certainly so many sad stories in addition to success stories. And I think, it takes a toll day after day to be seeing a lot of suffering. However, that's been something that we've really focused on and tried to make sure that we have great support. So we have what we call a lavender response, where if staff are feeling overwhelmed or stressed, this team of professionals can come directly to the staff member. We have a lavender line where staff can call if they just want to talk to someone. We're doing the same for family members that can call in terms of our caregiver line. Just really spiritually, as well as being present in the moment, doing whatever we can. If staff need time off, we'll allow them time off so that they can, spend time with their family. We're doing things like just really trying to recognize them through our board has been phenomenal. They're doing individual Zoom calls with staff, sending letters to the team, all of these things that really make staff feel like they're thought of and well cared for. And, the morale seems to be pretty good. Again, I won't, it's been difficult for staff, some staff who are afraid to go home because they have sick members at home, sick family members that may be immunocompromised. So we've been able to provide housing for them. The community has been incredibly supportive. The hotels in the area providing rooms, talking about support of the staff, the restaurants that are sending food, the community members that are sending food, donations. We're getting moisturizing masks for our staff, just anything and everything you can think of, just amazing support, which goes really a long way.
I said, there's no question that in the Bedford, Mount Kisco, Newcastle, all of the communities in that area of the county, there's a great affinity to the institution, that Northern Westchester really is a member of the family, the local family of services. And that kind of connection doesn't always happen, but it does reflect itself. The Holiday Inn Mount Kisco, as you mentioned, being available with rooms for those that need it, that are working shifts and need a place of respite without heading home, wherever home might be. Let's talk a little bit about the patient side of this. Obviously, the isolation requirements of a COVID patient make it impossible for them to be visited by family in the normal way. And in some cases, the severity of the illness, and in some cases, the near-death scenarios or the fatality scenarios make it a very lonely moment for patients. How do you try to keep families updated or in connection, and how do you try to keep patients somehow connected with their families at a moment where so much is hanging in the balance?
Right. So there is limited or restricted visitation right now. And so during this time, some of the things that we've done, we've tried to use technology. So we have deployed many iPads so that we can FaceTime and Zoom between patients and family members. We have gotten a huge donation of Amazon Alexa. So we're able to drop in and talk into patient rooms so that we have more frequent contact with them. And we have a lot of staff, team members that have volunteered to just visit with patients. One of our nurse managers, she had a personal experience where her mother-in-law had succumbed to COVID, and given what it was like for her family in terms of not being able to really be there, hold her mother-in-law's hand and be present, she came back to work, and she has created or reached out to a whole team of nursing staff who have volunteered their time to just go and visit with patients. And if they want, we will help them FaceTime to Zoom. Our palliative care team is rounding in the ICU, really connecting with families, again, via FaceTime for those patients that maybe can't do it themselves. We have a caregiver line for families, so families can call in for emotional support. And as well, we have a line where family members can call in to get daily updates. The staff are continually calling families to give updates, but they can also call in, speak with a physician. Our physicians have the iPads as well and can frequently drop in and talk with our patients, as well as we are being present with our patients. So all of those things to really try and get around the visitation requirements.
From the standpoint of where we go forward, one of the things that has been highlighted by public officials, healthcare professionals, public health professionals, is the necessity for testing both to determine whether or not you have the virus, testing to determine if you have antibodies, and then using contract tracing in an intense way that would help us really identify and isolate those that might have it. In Westchester, we've actually tested about 9% of our population, which is a fairly large percentage compared to others, but not enough for any jurisdiction to be happy. What's the status of testing right now at your facility?
Yeah, so I think that we're all looking forward to a period of time when there is certainly enough testing available so that widespread community testing can be done. But for right now, we are embarking on antibody testing for our staff, team members here at Northern Westchester. So Northwell is rolling this out to all of the hospitals within the system. On Friday, we will begin testing first any team members that we know had been COVID positive, and then we will be pushing this antibody testing out to all of our employees. Hopefully, as more tests become available, we will be able to test others next in the community, maybe frontline EMS, people that have had more contact with COVID positive patients, as well as essential workers. So a lot of that is to be determined, but we're hopeful we'll be able to roll that out very soon.
I should point out that the Northwell system, which Northern Westchester is part of, is the largest such system in New York State, if not in the whole region. Michael Dowling, who's the head of it, is very close with the governor, has been a very key advisor to the governor on these issues. It is Northwell that has provided the professional backdrop for the Glen Island testing site, which was the first drive-through testing in the county, probably the single biggest reason why we've tested as many people in Westchester as we've had. And between Northern Westchester and Phelps Hospital, also part of that network, you've really been able to provide a lot of work on the ground. Catherine, in closing, we last saw each other, you and your husband and I, at a rather convivial reception in anticipation of the St. Patrick's Parade in White Plains that ultimately never happened. And on that night, we had no idea that we would be going through this. So, you're well credentialed, well professional, master's degree, registered nurse. You're a leader as chief nursing officer. You still go home at night as an individual. You've made a commitment to this career. What do you think about all of this? How do you process all of this as an individual? What you're seeing, what you're experiencing? What does it tell you about not just what you know professionally, but what you see of the human element and the human spirit?
Yeah, I think that's been the one thing really trying to process. So for me, we all do it in different ways. I've been journaling. I've also been making sure that I stick with my usual routines, make sure I have time for exercise. John and I certainly spend time each evening kind of talking about our day. It's a lot to process. And I think while we are trying to do that, so is everyone else out there. Certainly all of my nursing staff here and healthcare professionals. And I think from everything I've read and what I've been able to do and experience, I think the more we stick with our routines, talk about what we're seeing, what we're feeling, and have a chance to really kind of start to process everything that we've seen and done and lived through. I think that, those are the things that we need to be doing.
I've said more than once in this forum that we are, you, I, and all the other people that I've had a chance to interact with, we're everyday Americans who are in certain roles and responsibilities. We've trained for whatever it is we're doing for a fair bit of our lives. But as you said earlier, and we all understand, no one could have anticipated the circumstances we're dealing with. And we're trying to rise to this moment, and each of us in our own way. And I think if I have any confidence that we're going to get through this, it's because of that. It's because of people like you, the people you work with, and so many others that I've met, that we each every day do our job, do it as well as we can. Not a lot of fanfare, not a lot of self-identification or promotion, but at the end of the day, if we all do it well, we'll get through this. And a lot of it, in large part, Catherine, will be with what you've done and what your team has done at Northern Westchester. And we thank you for being a guest and to share some of these thoughts with everyone on Facebook.
Thank you. Glad to have the opportunity, and thank you to you and your team for all that you're doing as well.
Thank you. We've been talking with Catherine Manley-Cullen, who is the Chief Nursing Officer at Northern Westchester Hospital, based in Mount Kisco, part of the Northwell Network. We will be back at 2 o'clock today. We will be remote up in Peekskill to give the 2 o'clock update with some information, sort of statistical information of where we are as of today, what progress hopefully is being made, and then also what other issues of importance. We try to be succinct to give you a few bullets of information that would be helpful to you, let you get on about the rest of your day, which you can use as you see fit as we all work through this coronavirus outbreak. I'm George Latimer, Westchester County Executive. Thanks for tuning in, and we'll see you about 2 o'clock. Have a good day.